nagbabalik ang Doctors on TV. Our topic is still colorectal cancer. At nandito pa rin, of course, yung favorite namin, kasi Dr. Diana Payawal. Doktora, ang dami naming tanong talaga. Tsaka, alam niyo, when you say colorectal cancer, syempre takot na tayo, but there is a procedure called colonoscopy. Doktora, paano ginagawin colonoscopy? Ito ba hindi nakakatakot na procedure?
Hindi naman po. It is actually a scope that you put. If you watch Mission Impossible, di ba, meron silang nilalagay na scope para makita. Ito ganun din. It's a scope. It's like a tube, and then at the end, there's a camera. At nakahook siya sa isang TV monitor. So we see directly what is happening inside the colon. Usually, one of the things that people always come to us late is sasabihin nila nagbi-bleed sila sa stools due to hemorrhoids. That's a very common thinking of the lay, dapat pag nagdugo ang dumi nila, hemorrhoids. It may be true, but if you never had colonoscopy, it is very difficult for you to just say it is due to hemorrhoids. So maganda po, siguro like what are the symptoms? If you have, for elderly, it's alternating constipation and diarrhea, so a change in bowel habits. Blood in stools definitely is an indication for you to undergo colonoscopy. But now, as I mentioned, meron na kami, the age is a factor. Colonoscopy at 50.
Dok, meron bang pain usually na nararamdaman yung pasyente once they have to have this polyp dun sa kanilang colon?
No, not unless it's an end stage wherein it has already obstructed. Ibig sabihin, kasi ang colon is a hollow tube. So if, let's say, the polyp is big enough to obstruct the feces from coming, nag-obstruction ka na, yun, magkaka-pain ka. But like bloatedness, it can be a manifestation of something else. So that's why we came across the age as a factor.
Dok, kasi may mga, pasensya na sa mga kumakain, I know this time is breakfast time, but this is very important, no? Sa pagdumi ng tao, doctor, may kinalaman din daw yung size, or yung, minsan kasi madami silang dumumi, or minsan kaunti. To know kung may problema
when I was
or
a fellow, we used to say goat stool-like, sibaloo stools, no?
Ibig sabihin ng bilog-bilog, Dok, na dry, na matitigas. Yan.
So,
pagka ganyan na yung dumi mo,
medyo siguro you have to see your gastroenterologist, but it can be a lot of factors.
Yeah.
Maybe you're not eating a lot of fruits or vegetables, fibers, and I think that's the number one dictum that we have, more fibers and more fruits.
In water, hydration
Of course,
is important.
hydration, yes. Hydration is important.
Mas marami bang nagkakaroon na babae or lalaki sa colorectal cancer?
There is no specific gender relationship. So, hindi kamukha ng liver. Most of our liver cancer has predominantly male, no? For this, we found out that it's 5:4. It's not really significant. So, gender is not a factor. So, everybody undergoes colonoscopy at 50.
Para po kunyari, sa mga nanonood sa atin ngayon, kunyari nanonood siya na 50 years old po ako ngayon, doktora, pupunta po siya sa clinic ninyo. Is there any preparation na kailangan niya gawin?
Yes, marami po itong steps, no? If you do not have the access of colonoscopy in your province, we have the so-called fecal occult blood. So, you submit your stools, no? And then, meron hong testing na tingnan kung may dugo ang dumi nyo. In that essence, if it's positive, you have to see your gastroenterologist. And there's a process. So, it's a procedure, so you have to undergo a cardiac workup. Kung matanda na po kayo, marami kayong comorbidities. Comorbidities meaning meron kayong hypertension, may coronary artery disease kayo, antiplatelet regimen kayo, so dapat i-hold yon. So, meron pong proseso. You have to go to your specialist. And we are trying in our society to train as much people or as much doctors for this specialty. So, lahat ng centers po magkaroon ng gastroenterologist, and that's accredited by the society.
Okay, doctor.
Doktora, is there a thing as blood test to check for cancer predisposition?
The CEA, it's like a marker, but we found out that it is not significant in early cancer. So, hindi naman, as gastroenterologists, we're here to prevent. No? So, that's why, if you use CEA as a marker, hindi na po natin makikita yung maaga. Kasi kung normal, does not mean. In fact, there are some colonic cancer that have normal CEA. And there are some patients sent to us with high CEA. We find out there's nothing inside, no? So, the best thing po is a fecal occult blood if you don't have access of colonoscopy. And of course, if it's positive, to undergo colonoscopy.
One of the reasons kasi kaya yung mga kababayan natin ayaw talaga magpa-check up is of the possible treatment
Expenses.
procedures na kailangang ipasagawa. Every time ba, doctor, na may nakikita kayong polyp or possibility of having a colon cancer, equivalent na ba yan sa surgery or surgical procedures?
We are minimally, we cut inside. We remove the polyp inside and you can go home. Minimally invasive.
Meaning to say kasi, doctor, when you mentioned cut the polyp inside, you don't,
Hindi.
do you cut them and open them up? Oo,
Sorry.
doc, oo.
Through the endoscope, we put gadgets inside, and then we cut inside. We will show it in our film. We can cut inside, and we can biopsy inside,
Wow.
and try. And then we submit this for histopathology, and then if it's positive, like if it's like tubulovilus, ibig sabihin malapit na yun sa cancer, then you have to be monitored closely. But if, as I mentioned, if it is normal, 5 years.
Very
So,
good.
mga kasambahay, wala na itong hiwa. Wala nang cut ito.
Hiwa sa, dito sa
Dito,
hindi.
yun ang
We don't
kinakatakutan
do that.
kasi,
Hindi po.
no?
Yung iba, takot na takot kasi sa hiwa. Ayan,
We
oo.
maximize our
So,
strategy.
colonoscopy na lang, doktora. At konting-konti na lang talaga na.
And you will not feel because you're actually under sedation. So, kahit mag-cut kami sa loob, you don't feel anything.
Doc, you've mentioned kanina, may habol ko lang, no, about the polyps. Posible ba na isa lang yung polyp na makikita nyo sa loob? Or,
Yes, we have, no, there can be multiple polyps.
okay.
Meron ho kaming nakita ngayon sa bagong pinag-aaralan namin, yung serrated polyps. These are polyps that do not undergo the small to, the benign to malignant. So, ibig sabihin, maaga pa lang, talagang i-monitor mo to kasi the range of cancer is shorter. Kasi in colorectal cancer or in the Vogelstein theory, it takes 10 to 15 years. Pero ito, maybe 2 to 3 years. It's a new concept that we're trying to study. Serrated polyps.
So, talagang makakat short natin yung parang waiting period. Or pwede na talagang ma-prevent, doktora.
Opo.
That's good news.
That's why the recommendation of the society is we did our share. We did our guidelines, which we will lobby in PhilHealth. We already are under PhilHealth deductibles procedures. And I think we have gastroenterologists. The hospital has colorectal packages every March. Kung wala man kayong you can talk to your gastroenterologist and I think they will have programs for you.
So, dapat wala na talagang rason para hindi magpa-check up ang ating mga kasambahay. Ako may 4 years pa ako, Doc. Bago ako magpa-check up.
Kasi doktora, may sponsorship Magsa-sponsor si doktora ng procedure, ng colonoscopy. Thank you, doktora.
We can help your program for colonoscopy.
Thank you very much, doktora. From Fatima University, doktora,
Yes,
no?
from Fatima.
Ang dami nating sponsorship mga kasambay sa Fatima University. Thank you very much.
Thank you so much, Doktora. Pero bago po natin ipagpatuloy ang maganda nating talakayan, no? Lagi po nating kasing naririnig na prevention is always better than cure. Kaya alamin po natin na mga natural na pamamaraan kung paano po tayo makakaiwas sa mga karamdaman. Dito lamang po yan sa Naturally Yours.